Most people think diabetes announces itself with obvious symptoms: constant thirst, frequent urination, maybe weight changes. But here's the uncomfortable truth. In many cases, the earliest warnings don't show up in your blood sugar readings. They show up in your feet. And that's exactly where most people miss it. My name is Dr. Xeno Phantom, and I've been practicing medicine for over 15 years, working with patients struggling with metabolic dysfunction, insulin resistance, and early-stage diabetes, often without realizing it. I remember one patient clearly, a 54-year-old male office manager. He came in complaining of weird tingling in his feet, mild burning at night, and occasional numbness when walking. His fasting glucose? Only mildly elevated at 118D mRDL. Nothing that looked alarming on paper. But his feet were already showing early neuropathic changes. Within 9 months, despite intervention, his HbA1c had progressed from 6.1 to 7.2, full diabetes range. Today, I'm going to show you exactly 9 warning signs in your feet that could mean diabetes is already developing in your body, even before standard tests fully catch it. And this matters more than most people realize. According to the International Diabetes Federation, over 537 million adults worldwide are currently living with diabetes, and nearly 1 in 2 don't even know they have it early enough to prevent complications. Most people miss this because they're only looking at blood sugar, not what high insulin and glucose are doing at the nerve level, blood vessel level, and microcirculation level in the extremities, especially the feet, where circulation is already weakest. Here's what's really going on inside your body. Insulin resistance slowly damages small blood vessels and nerves, cutting off oxygen and nutrient delivery. Your feet become the early warning system of metabolic dysfunction. Today, I'll break down the 9-foot signs your body uses to signal this breakdown, and more importantly, what you can do to reverse the process naturally before it progresses. Because once your feet start talking, your metabolism is already asking for help. Before we go deep into the signs, let me give you the framework so everything makes sense physiologically. Here are the 6 science-backed insights we'll break down. How early nerve damage from insulin resistance shows up in the feet before blood tests become alarming. Why poor circulation in the smallest blood vessels is one of the earliest metabolic warning signs. How chronic inflammation silently damages peripheral nerves, even without pain at first. Why fungal infections and skin changes in the feet can reflect blood sugar imbalance. How nutrient deficiencies like B12 and magnesium worsen diabetic nerve symptoms. What daily habits can improve nerve repair, circulation, and insulin sensitivity naturally. Now here's the important part. Your feet are not just feet. They are one of the most vascular, nerve-dense, and metabolically sensitive areas of your body. Let's move into the first warning sign. And I want you to pay close attention because this is where most people first notice something is wrong, but dismiss it. Sign 1. Tingling or pins and needles in your feet, and why it's not random. And this is the one patients often ignore the longest. Most of my patients tell me they think this tingling is just from sitting too long, or maybe bad posture or tired legs. They assume it's temporary nerve compression, nothing serious. But here's what's actually happening inside your body. When blood sugar stays elevated over time, even mildly, glucose starts damaging the tiny blood vessels that feed your peripheral nerves. These nerves in your feet are extremely long and fragile, so they're the first to suffer. At the same time, insulin resistance reduces nitric oxide production, meaning your vessels can't relax properly. Less blood flow, less oxygen, nerve irritation. So that tingling? It's not random. It's your nerves literally starving for proper circulation and energy supply. Let me explain this with a simple analogy. Imagine your nerves are like electrical wires in a house. The insulation around those wires depends on steady maintenance and energy supply. Now imagine that maintenance crew stops showing up regularly. The insulation starts breaking down. You begin to hear flickering, static, and inconsistent signals. That's exactly what insulin resistance does to your peripheral nerves. It disrupts the maintenance system. According to the American Diabetes Association, Up to 50% of people with diabetes develop some form of diabetic neuropathy. And in many cases, early nerve symptoms appear years before diagnosis. My recommendation for every patient noticing early tingling is simple. 20-30 minutes of daily walking after meals, especially dinner. 1 to 2 grams of magnesium glycinate in the evening supports nerve signaling. Reduce refined carbs for at least 14 days to lower glucose spikes. This combination alone can significantly reduce nerve irritation in early stages. If you feel tingling even occasionally, don't normalize it. Your nerves are speaking early. Sign 2. Burning sensation in the feet, especially at night. And this one often wakes people up without them realizing what's behind it. Most of my patients tell me they assume this burning feeling is just from fatigue, walking too much, or even hot weather. They often think it's skin-related or temporary irritation. But here's what's actually happening inside your body. When insulin resistance progresses, it doesn't just affect blood sugar. It creates a chronic low-grade inflammatory state. This inflammation damages the small, unmyelinated nerve fibers responsible for temperature and pain sensation. At night, when blood flow naturally slows down and your body is in repair mode, these damaged nerves become hypersensitive. They misfire signals to your brain, creating that burning, heat-like sensation, even when there's no external heat source. At the same time, microvascular constriction reduces oxygen delivery, which intensifies nerve stress further. So this isn't a skin problem, it's a nerve oxygenation problem. Let me explain this with a simple analogy. Imagine a house with a faulty thermostat system. Instead of regulating temperature correctly, the system starts sending incorrect signals, turning heating on when the room is already hot. That's exactly what damaged peripheral nerves do in diabetic or pre-diabetic states. They misinterpret normal conditions as burning danger signals. According to the Journal of Diabetes Research, neuropathic pain symptoms affect up to 30–50% of individuals with diabetic peripheral neuropathy, and early inflammatory nerve damage can begin years before full diagnosis. My recommendation for every patient experiencing nighttime burning: keep feet cool before bed, avoid overheating blankets, do 5 to 10 minutes of gentle foot elevation to improve venous return, add omega-3 rich foods, like sardines or flaxseed, daily to reduce nerve inflammation. Avoid late-night high-carb meals that spike overnight glucose. These small interventions reduce nerve excitability and improve overnight recovery. If your feet feel like they're burning from the inside, don't ignore it. This is not surface heat. It's metabolic inflammation showing itself early. Sign 3. Numbness or dead feeling in the feet. And this is the one that often shows up quietly, then slowly becomes normal, which is the most dangerous part. Most of my patients tell me they think numbness is just aging, or maybe poor footwear, or sitting too long. They assume it's harmless because it doesn't hurt. But here's what's actually happening inside your body. Numbness is not a lack of sensation. It's a loss of nerve communication. In early metabolic dysfunction, chronically elevated glucose damages the myelin sheath, which is the protective coating around nerves. At the same time, high insulin levels reduce microcirculation, meaning nerves in the feet are slowly deprived of oxygen and nutrients. So the signal doesn't disappear suddenly. It fades, first tingling, then reduced sensitivity, then full numbness. This is one of the clearest signs of progressing diabetic neuropathy. And here's the key insight: pain nerves usually recover last. So when numbness appears, it often means damage has already been ongoing for years. Let me explain this with a simple analogy. Think of your nerves like internet cables in a city. At first, the connection is slow, buffering, lagging. Then, messages drop randomly. Finally, parts of the city go completely offline. That's what numbness is. Not a sudden failure, but a gradual collapse of communication lines due to metabolic network damage. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, diabetic peripheral neuropathy affects up to 60–70% of people with long-standing diabetes, and sensory loss is one of the most common early physical signs before diagnosis. My recommendation for every patient noticing numbness: daily barefoot sensory stimulation on safe surfaces, grass, carpet textures, for 5 to 10 minutes. Vitamin B12 support through diet, eggs, fish, dairy, or supplementation if deficient. Tight glucose control after meals. Walk 10-15 minutes post-eating. Avoid prolonged sitting. Stand and move every 30-45 minutes. These steps help reawaken nerve signaling pathways and improve circulation to the extremities. If your feet feel less alive than they used to, don't dismiss it as aging. This is often one of the clearest early metabolic red flags your body gives you. Sign 4. Cuts, wounds, or sores that heal slowly on the feet. And this is one of the most clinically important early warnings, even before diabetes is fully diagnosed. Most of my patients tell me they assume slow healing is just due to dry skin, aging, or maybe walking too much. They think it's a minor skin issue, not a metabolic one. But here's what's actually happening inside your body. When insulin resistance develops, two major systems start failing at the same time. First, blood flow becomes impaired. High glucose damages the endothelial lining of small blood vessels, especially in the lower extremities. That means less oxygen, fewer immune cells, and slower delivery of repair nutrients. Second, immune function becomes less efficient. White blood cells don't respond as quickly in a high glucose environment, so even small cuts take longer to close. The feet are the furthest point from the heart, so they are the first place where this slowed repair process becomes visible. That's why a simple blister or scratch can linger much longer than expected. Let me explain this with a simple analogy. Imagine a construction site trying to repair a broken road. Normally, trucks, blood cells, deliver cement, tools, and workers quickly. But now the main highway is partially blocked and half the trucks are stuck in traffic. So repair slows down dramatically, not because the workers are lazy, but because the supply chain is disrupted. That's exactly what happens in insulin resistance. Your repair system is intact, but delivery is broken. According to the American Diabetes Association, about 1 in 4 people with diabetes will develop a foot ulcer during their lifetime, and delayed wound healing is one of the earliest visible signs of microvascular dysfunction. My recommendation for every patient noticing slow healing skin on the feet: inspect feet daily for even small cuts or redness. Keep blood sugar stable by avoiding large carbohydrate spikes. Increase protein intake. Supports tissue repair and collagen synthesis. Use 10-15 minutes of post-meal walking to improve microcirculation. Keep feet moisturized to prevent skin cracking, which increases infection risk. If small wounds on your feet are taking longer than usual to heal, don't ignore it. This is your circulation and immune system quietly slowing down at the same time. Sign 5. Cold feet. Even when the rest of your body feels warm, and this is one of the most misunderstood early metabolic warning signs. Most of my patients tell me they think cold feet are just due to weather, poor socks, or low iron. They rarely connect it to blood sugar or insulin resistance, but here's what's actually happening inside your body. When insulin resistance develops, your body's ability to regulate microcirculation becomes impaired. The smallest arteries and capillaries in your feet start to constrict because nitric oxide signaling, the molecule that tells blood vessels to relax, is reduced. At the same time, glucose fluctuations can trigger subtle autonomic nervous system dysfunction, meaning your body mismanages heat distribution. So even if your core temperature is normal, your extremities, especially the feet, may receive less warm, oxygenated blood. This is not a temperature problem. It is a vascular signaling problem. Let me explain this with a simple analogy. Imagine your body as a central heating system in a house. The furnace is working fine, but the pipes going to the far rooms are partially clogged and narrowed. So the living room is warm, but the upstairs bedroom stays cold no matter how much you increase the heat. That's exactly what happens in early metabolic dysfunction. The heating system, heart and core circulation, is fine, but delivery to the extremities is failing. According to research published in Diabetes Care, impaired peripheral circulation is present in a significant proportion of pre-diabetic individuals, even before full diabetic diagnosis, and reduced foot temperature has been linked to early microvascular dysfunction. My recommendation for patients with chronically cold feet: 10 to 15 minutes of brisk walking daily to stimulate peripheral circulation. Contrast foot bathing, warm water followed by cool water, for 3 to 5 minutes. Increase dietary nitrates, beetroot, leafy greens, to support nitric oxide production. Avoid long periods of sitting without movement breaks. Maintain stable blood sugar to reduce vascular constriction episodes. These steps help retrain vascular responsiveness over time. If your feet are consistently cold while the rest of your body feels normal, don't dismiss it as weather. This is often one of the earliest signs your circulation is starting to slow down at the smallest level. Sign 6. Swelling in the feet or ankles, especially at the end of the day. And this one often gets mistaken for simple fatigue swelling. But metabolically, it can be far more significant. Most of my patients tell me they think swollen feet are just from standing too long, heat, or eating salty food. They assume it's a temporary fluid issue that has nothing to do with blood sugar. But here's what's actually happening inside your body. When insulin resistance develops, it doesn't only affect glucose, it also affects kidney sodium handling, blood vessel integrity, and capillary permeability. High insulin levels signal the kidneys to retain more sodium. Sodium pulls water with it, increasing fluid retention. At the same time, damaged microvasculature becomes leaky, allowing fluid to escape into surrounding tissues, especially in gravity-dependent areas like the feet and ankles. So swelling is not just water overload, it's a combination of hormonal imbalance plus vascular dysfunction. This is why it often appears at the end of the day, when fluid naturally accumulates downward. Let me explain this with a simple analogy. Imagine your body's circulation system is like a city's drainage network. Normally, water flows smoothly through well-sealed pipes and returns efficiently to the main system. But now imagine two problems at once. The city is holding too much water, hormonal sodium retention, and some pipes have tiny leaks, capillary damage. So water doesn't just flow, it starts pooling in low-lying areas. That pooling is exactly what you see as swelling in the feet and ankles. According to clinical data reviewed by the American Diabetes Association, fluid retention and peripheral edema are more common in individuals with insulin resistance and poorly controlled glucose metabolism, particularly when kidney stress begins to develop alongside early metabolic syndrome. My recommendation for patients noticing swelling in the feet: elevate legs for 10 to 15 minutes twice daily to assist venous return, reduce ultra-processed and high-sodium packaged foods. Walk 10-20 minutes after meals to activate calf muscle pump. Second heart. Stay well hydrated to prevent the body from over-retaining sodium. Monitor carbohydrate intake to reduce insulin-driven fluid retention. These habits directly reduce fluid buildup by improving circulation and hormonal balance. If your feet or ankles are swelling regularly, especially at the end of the day, don't ignore it as simple fatigue. This is often your circulation and hormone system struggling to keep fluid balance under control. Sign 7. Skin color changes: pale, bluish, or shiny feet. And this is a sign most people notice visually but still underestimate. Most of my patients tell me they think color changes in the feet are just from lighting, bruising, or natural skin tone differences. They don't connect it to circulation at all. But here's what's actually happening inside your body. When insulin resistance progresses, chronic damage to small arteries reduces consistent oxygen delivery to the skin and underlying tissues. As blood flow becomes restricted, the skin can appear pale, bluish, or even take on a glossy, tight, shiny appearance. This happens because skin cells are not receiving enough oxygen and nutrients to maintain normal texture and pigmentation balance. Over time, reduced collagen repair also makes the skin thinner and more fragile. So what you're seeing is not just cosmetic. It is a visible map of reduced microcirculation. Let me explain this with a simple analogy. Think of your skin like a well-watered garden lawn. When irrigation is strong, the grass is green, soft, and healthy. But when water pressure drops and nutrients stop reaching the soil, the lawn becomes patchy, dry, and discolored. Your skin works the same way. It reflects the quality of underlying blood flow. According to vascular research published in the Lancet Diabetes and Endocrinology, peripheral vascular changes often appear early in individuals with insulin resistance and are strongly associated with future risk of diabetic complications. My recommendation for patients noticing skin color changes in the feet. Daily, 10 to 15-minute brisk walk to improve capillary perfusion. Warm foot soaking, not hot, for 5 to 10 minutes to stimulate circulation. Increase antioxidant foods, berries, leafy greens, to support vascular health. Avoid smoking or nicotine exposure, which worsens vessel constriction. Maintain stable blood glucose to prevent further microvascular damage. If your feet are visibly changing color or texture, don't dismiss it as cosmetic. This is your circulation system becoming visible on the surface. Sign 8. Frequent fungal infections, itching, or athlete's foot that keeps coming back. And this is one of the most overlooked metabolic clues. Most of my patients tell me they think recurring fungal infections are just from sweating, hygiene, or tight shoes. They treat it as a surface skin problem only. But here's what's actually happening inside your body. Elevated blood glucose creates an environment where fungi and yeast thrive more easily. At the same time, insulin resistance weakens local immune defenses in the skin, reducing the body's ability to fight recurring infections. In simple terms, higher sugar, P+, weaker immunity. Repeated fungal growth cycles, especially in warm, moist areas like between toes. This is why infections keep coming back even after treatment, because the underlying metabolic environment hasn't changed. Let me explain this with a simple analogy. Think of your skin like a house. Normally, security guards, immune cells, quickly remove intruders. But now imagine the house has extra food lying around everywhere, and the guards are tired and understaffed. Even if you remove the intruders once, they keep coming back because the environment is still inviting. That's what high blood sugar does. It creates a fertile environment for infection. According to the Centers for Disease Control and Prevention, CDC, individuals with diabetes are significantly more prone to fungal infections, and recurrent skin infections are often an early indicator of poor glucose control. My recommendation for recurring fungal symptoms: keep feet dry, especially between toes. Change socks daily or twice daily if sweating. Reduce refined sugar intake for at least 2 to 3 weeks. Include probiotics, yogurt, kefir, fermented foods to support microbiome balance. Monitor and stabilize post-meal blood sugar spikes. If infections keep returning, don't just treat the skin, correct the metabolic environment feeding it. Sign 9. Pain or cramping. In feet, calves. While walking, peripheral artery stress. And this is one of the most serious warning signs on this list. Most of my patients tell me they think calf pain when walking is just aging, dehydration, or being out of shape. They often ignore it until it becomes severe. But here's what's actually happening inside your body. This symptom is often linked to reduced arterial blood flow, a condition called peripheral artery disease, PAD, which is strongly associated with insulin resistance and diabetes. When you walk, your muscles demand more oxygen, but narrowed or damaged arteries cannot supply enough blood quickly, so pain or cramping develops, usually forcing you to stop and rest. This is not muscle weakness. It is oxygen starvation under load. Let me explain this with a simple analogy. Imagine trying to water a garden while the hose is partially clogged. At rest, a small trickle is enough, but the moment demand increases, when you turn on multiple sprinklers, the system fails and pressure drops. That's exactly what happens in your legs during walking if circulation is compromised. According to the American Heart Association, individuals with diabetes are 2 to 4 times more likely to develop peripheral artery disease, and intermittent leg pain is one of the earliest functional symptoms. My recommendation for early circulation-related leg pain: structured walking, short intervals, 5 to 10 minutes, repeated throughout the day. Gentle calf stretching to improve vascular flexibility. Strict blood sugar control through reduced refined carbohydrates. Hydration to support blood viscosity and flow. Medical evaluation if pain consistently appears during walking. If walking starts to cause pain or cramping in your legs or feet, don't push through it blindly. This is a direct signal that your circulation system is under strain. What your feet are really telling you now. Let's connect everything. Your feet are not random body parts giving random symptoms. They are one of the earliest and most sensitive reporting systems of your metabolic health. Tingling, burning, numbness, slow healing, coldness, swelling, color changes, infections, and walking pain. These are not separate problems. They are different expressions of the same underlying issue: early insulin resistance and microvascular damage. Here's the deeper physiology. High insulin disrupts blood vessel flexibility. Elevated glucose damages small nerves and capillaries. Chronic inflammation slows repair systems. Poor circulation reduces oxygen delivery. Immune response becomes less efficient. Over time, your body stops communicating clearly, and your feet often show the first signs of that breakdown. But here's the empowering truth. This process is not only detectable early, it is also reversible in many cases when addressed properly. Improving walking habits, stabilizing blood sugar, reducing processed carbohydrates, supporting nerve nutrients like B vitamins and magnesium, and improving circulation through daily movement can significantly slow or even improve early metabolic dysfunction. Try this simple challenge. Pick just one habit from today, maybe post-meal walking or sugar reduction for 14 days, and observe how your feet respond. Because your body always responds when the environment changes. If this added value, like the video and subscribe, and join others who are learning how to optimize their health naturally before disease takes control.